Hello, everyone. Welcome to the Your Mark on the World show for Good Crowd Info. We're excited to have today with us a very urgent plea for help from the folks at Global Giving, Develop Africa, and the Imani House. These folks are working together to crowdfund some money to help bring some relief to those who are suffering from this Ebola outbreak that is really creating a crisis of really global proportions as people around the world are beginning to get anxious about the rapid spread of this terrible disease. First off, let's go to you if we could, Britt. Thank you very much for joining us. Britt Lake is the program director, or excuse me, the program director at Global Giving. Tell us a little bit about what you're doing at Global Giving to help with this situation.
Thank you so much for having us and hosting us on this show, especially about such an important topic. So for those who don't know, globalgiving.org is the first international crowdfunding site. We've been around about 12 years, and you know, this is an example of a crisis going on in the world that, you know, we have really seen the demand from the ground from organizations working in West Africa that they really need resources to affect and respond to the medical crisis that's happening right now with Ebola. So as a result of really the response and requests that we've gotten from our nonprofit partners on the ground, this morning, we launched a Ebola Epidemic Relief Fund, and that fund is going to support our local partners right now. There's about 5 of them working in Sierra Leone, Liberia, Guinea, and Nigeria to respond to this crisis.
Terrific. We also have with us Sylvester Renner of Develop Africa. So, Sylvester, tell us a little bit. You know, you're reporting from, you're joining us from Tennessee, but I want you to tell us what you know about what's going on the ground there in Africa around this crisis.
Thanks for having me on this hangout, Devin. As people may know, some of the listeners may know, this crisis broke out a couple months ago, 3 months ago, and it's been growing into an epidemic proportion right now, and the numbers of people who have been affected just in Sierra Leone, where we have operations, is over 129 have survived the disease, and there are 169 confirmed deaths, and this has been spreading in four countries, as Britt mentioned, in Sierra Leone, Liberia, Guinea, and in a limited case in Nigeria. So we're doing the very best we can to get to a point of containment, which is what we're really focusing on, as there is presently no specific cure for the disease. So that's what we're trying to do together with the other partners who are involved in this effort.
Sylvester, can you tell us about what containment looks like on the ground, how that's being affected?
Right now, there are 2 major centers in Kenema and Kailahu, where they have a containment center set up, and what they're doing basically is cases of people who are confirmed reports or who are suspected to have the virus are being taken to those locations where they are being treated as best as they can. We have had a few cases of people who have actually recovered. Ebola has 60 to 90% fatality rate, so there are people who actually recover from it who are able to get rid of the disease and survive the disease. So at this point, the efforts are focusing on 2 things. Number one, providing the equipment that they need for the medical personnel that are taking care of these patients, and secondly, sensitization, information sharing to people so that they would know how to protect themselves from getting infected.
Sure. What is the treatment? What are you doing, or what is being done for the people who are sick?
Basically, they're provided with, a few of them might be receiving experimental drugs, but at this point, there's nothing really specific that is a surefire, like a definite drug you can provide to them, but they're being isolated and, you know, given fluids to keep them hydrated, and basically anything that they can do to boost up their immune system to try to see if that will help them get through this.
It really is tragic to think about this disease because it is fatal so much of the time. How is it spread? How is this epidemic suddenly growing? Because Ebola's been around for a long time, but this is, I think, the worst outbreak of Ebola ever.
I think part of the problem has been there are a number of different reasons, from local practices where, and there's been a whole issue where people have not been adequately prepared. They haven't known how to handle people who get sick and know how to isolate themselves as far as handling bodily fluids. So the virus has spread through lack of knowledge from people, where people have been maybe basically trying to help somebody who's sick, not realizing that your best bet is to isolate the person rather than try to care for the person yourself. So well-meaning relatives and friends have tried to do that, and that has resulted in the spread. So that's why it's essential that we do as much sensitization as possible so that people can understand, what transfers this and how they can protect themselves.
So it's principally from bodily fluids. Does that mean that it can spread from things as routine as, the saliva?
There's been debates as far as how exactly it's spread, but yes, it can happen through contaminated surfaces, where maybe somebody has sneezed on something and you somehow there's a break in your skin, or for some reason it gets into your bloodstream down into your nasal system, and then of course you could get infected from that.
Wow, it really is scary, and it has people, I think, around the world scared. So it's why it's so incredibly important that we help alleviate the problem now, so that we can save more people. Right? We've got to prevent the spread. So tell us a little bit more about. Britt, maybe you could tell us about the process of giving to these 5 organizations that are working to alleviate the crisis now.
Sure. So as I mentioned this morning, Global Giving launched a fund, and that fund will go to the organizations that are in the most need. So as the need changes from country to country, or prevention to treatment, that fund can respond more quickly. We also have a page, and the link is down there on the bottom of my screen, globalgiving.org/Ebola, that lists those 5 organizations and the countries they're working in. So if someone does want to give to a specific organization, such as Sylvester's, Develop Africa, or one of the others, they can choose those. In each of those instances, we also make sure to provide frequent updates on how those funds are being spent and how those funds are having an impact on the ground. So we know that, if you are a donor, no matter how much or how little you give, you want to make sure that your funds are going to where they are best used, and we want to make sure that donors do get that information about the effect that their funds are having.
Well, it really is just a wonderful thing that you're doing. Tell us a little bit, if you can, Britt, about the other 4 organizations. Of course, Sylvester's giving us a good introduction to Develop Africa. What are the other organizations that are involved?
Great question. So let me just pull those up for you now. In addition to Develop Africa, is working in Sierra Leone, we're also working with BRAC, and they are working both in Sierra Leone as well as Liberia. Their work on global giving primarily is focused on Sierra Leone, and they are working to support their all-female frontline force. They have 400 community health promoters who are going out in the areas to prevent the spread of the virus, really spreading information, paying for information like flyers and leaflets, travel costs, but also prevention such as disinfectant and things to help spread the actual disease. We're working as well with a group called Greatest Goal Ministry. This is an organization that funds a clinic in Sierra Leone. While this clinic is specifically an Ebola treatment center, it is directly across the street from one, and they are seen as individuals coming with potential symptoms. They're looking for requests for chlorine bleach, masks and eye shields, coverall protective suits, really things to help prevent the spread of this disease in their clinic, and help them treat to have those symptoms. Fourth, we're working with Doctors Without Borders. They're working both on the agent spreading, giving people information about how it spread, how to prevent it, what to do when they see symptoms, as well as the actual treatment throughout West Africa. And then finally, Amani House is a clinic, works with a clinic in Liberia. And again, much like the clinic we work with in Sierra Leone, they are not specifically an Ebola treatment clinic. They are seeing the effects of this epidemic within the patients they're seeing and want to protect both the patients as well as protect their own staff that work in the clinic.
This is really helpful information, Britt, and I really appreciate you taking the time to introduce us to these opportunities for people to help. Sylvester, I wonder if you would tell us just a little bit more about how people can give to your campaign particularly before we wrap up.
Specifically, you can find our campaign listed right there on Global Giving. On the homepage, if you go directly to the Global Giving homepage, globalgiving.org/Ebola, as Britt mentioned, if you give to the fund there, the resources, of course, we will get a portion of those funds. And I think you can also maybe search for our projects within Global Giving by just searching for Develop Africa.
Fantastic. Well, thank you both for your time, and thank you for the good work you're doing. My heavens, this is such an important effort to get our hands around and prevent the spread of Ebola before it becomes an even bigger problem. And so thank you. Thank you for the work that you're doing and for the time you took on short notice to be with me today.
Thank you, Devin.
Great. Thank you so much for having us.
Thanks for
All right. Let's do some good.
Thank you.